Hi, hope you're all doing fine. In this video, let's discuss a few important topics in endodontics, right? So you can pause the video here. You can just take a book, a piece of paper and pen and start noting down all the list of important topics which I'm going to discuss, because it's a quite elaborate list, so I didn't really put that on board, right? So hope you have a piece of paper and pen with you, and you can start entering them in your notes the moment I keep on reciting, right? So I'll be dividing the list of topics into various sections, and in each section I'll be discussing the list of important topics based on the frequency of repetition in various previous entrance exams, right? So coming to the topic of anatomy of pulp cavity, we actually made one video on anatomy of pulp cavity, and it's there in YouTube. You can watch that for more information regarding the anatomical features, various incidents of canals, everything. So I've done a PowerPoint presentation. I posted that video on YouTube, right? So in anatomy of pulp cavity, you have these following topics on which there were several questions. The number of extra canals and their location in case of maxillary first molar and maxillary first premolar, asked in previous COMET 2014 and PGI 2012. And also we have several questions on mandibular first premolar, which is considered as an enigma to an endodontist, right? So we have questions on mandibular first premolar, the bifurcation of canals, the number of canals, etc., and also Wien's modifications in mandibular first premolar, asked in KSET 2012. And also we have questions on access cavity designs in anterior teeth. What should be the orientation of the burr? What should be the access cavity shape in anterior teeth? For that matter, access cavity shape for all the teeth, right? You need to focus on this topic as well. Cavity design in mandibular first premolar, the same, the access cavity design, and what should be the orientation of the pulpal floor in mandibular first premolar, since the crown is lingually tilted by 30 degrees, right? So we need to understand all the features, right? And access cavity shapes in mandibular first molar. So we have many questions on access cavity shapes as such, right? Asked in AIMS 2012. And also we have question on a percentage incidence of two canals in mandibular incisor. So in Cohen we have a separate table where the percentage incidence of various extra canals are mentioned in all the teeth, in all permanent teeth, right? So this question was asked in AIMS 2013, the percentage incidence of two canals in mandibular incisors. And also the basic question, objectives of access cavity preparation, asked in COMET 2014. We have a question on this particular topic, right? And also we have questions on C-shaped canals, asked in PGI 2013. Radiographic identification of extra canals or bifurcation of canals, asked in PGI 2013 and 2014. So radiographically, how do you identify extra canal or a missed canal, right? And this is pertaining to anatomy of a pulp cavity, right? And then coming to various diseases of pulp and periradicular tissues. So obviously we need to focus on the classification, WHO classification of periradicular diseases, and also we need to focus on the synonyms of various conditions, the clinical features and treatment aspect, right? And to be more specific, right? So we have questions on internal resorption, asked in NEET 2013. Questions on features of pulp inflammation, asked in NEET 2013. Features of chronic alveolar abscess, Karnataka 2013. Intrapulpal pressure, asked in COMET 2013. And we have several questions on the diagnostic part of cracked tooth syndrome and also the management aspect, asked in COMET 2013. And also we have questions on differential diagnosis of pulpitis and maxillary sinusitis, especially in case of upper maxillary teeth. So we need to differentiate whether that's the pain source is from the sinus infection or from the pulpal origin, right? So we have questions on that as well, asked in COMET 2013. Also, we need to focus on A delta fibers, C fibers. So we have several questions on these topics in AP 2013. And also, as I mentioned previously, WHO classification of periradicular diseases, asked in Karnataka 2013, right? Question on endodontic flare-ups, asked in AIMS 2013. Various nerve fibers in pulp and their whether they are myelinated or unmyelinated. Do we have afferent or efferent fibers, right? So we need to focus on that basic part as well, asked in AIMS 2013. And also we have several questions on differentiating acute abscess, acute periapical abscess and a chronic abscess, as well as differentiating acute periapical abscess and phoenix abscess, which is nothing but acute exacerbation of a chronic lesion or chronic abscess, right? Asked in GSET 2014. And also we have question on Enterococcus fecalis, asked in APPG 2016. So E. faecalis is most commonly associated with a failed or retreatment cases, endodontic infections. I mean, we have a lot of information on E. faecalis specifically given in Grossman as well as Cohen, right? So we need to focus on E. faecalis microorganism, whether it's gram positive or negative, and what's the reason why it is being associated with various failed retreatment or failed root canal cases. Especially in case of persistent infections, we commonly isolate E. faecalis. We need to list out the reasons. We need to understand those reasons as well, right? So that's pertaining to various diseases of pulp and periradicular tissues. And then coming to biomechanics. Biomechanics in the sense biomechanical tooth preparation, BMP, cleaning, shaping procedures, various files, various irrigants, various medicaments. So all these come under this topic, right? So in biomechanics, you have questions on the cross sections of various instruments, right? So reamer, file, the basic standardization of instruments, you need to focus on that first. And we have one video on standardization. I posted around 5 to 6 videos in Endo, and we'll be making more and more videos this coming week, right? So you can find all those videos in playlist in YouTube as well. And we also have questions on objectives of cleaning and shaping asked in Karnataka 2013. Question on crown down technique asked in PGI 2016 latest. And also we have various questions on file systems like ProFile, ProTaper, right? And also retreatment files of ProTaper, right? We need to focus on these file systems also, all that given in Cohen as well as Grossman, right? Also we have questions on various irrigating solutions like Dakin solution asked in Comet 2013. Cleaning of files, how do you clean your files? Gauze and hypochlorite solution, right? So that question was asked NAMES 2012. And also have questions on diagnostic instruments, especially DC16 Endodontic Explorer. And we have obviously we have questions on a standardization of endodontic instruments, and we have a question on file with R-phase technology. We have this M-wire technology, R-phase technology, right? Various newer files being produced by these technologies. We need to focus on these as well. Just know which file system is being made from which technology, R-phase or control memory phase, right? We have these M-wire technology, various technologies, right? And also we have questions on glass bead sterilization, right? AP 2014. And also question on spreaders, GG drills, H files, sodium hypochlorite functions, hero files, right? So as I mentioned, you have questions on various hand instruments, rotary instruments as well. And there was one question in PGI 2016 where they were asked to expand or what does hero stand for? HERO, hero files, right? So hero is nothing but high elasticity in rotation. Likewise, we have a race, race files, right? So we have a reamer with alternating cutting edge. So we have various acronyms as well, right? We need to focus on them as well, right? Also we have questions on differences between stainless steel and Nite asked in PGI 2012. Properties of Nite, shape memory and super elasticity asked in Kerala 2015. Also questions on files for removing GP. So we have that question like, should we use K file, H file, right? H file we obviously use, right? So asked in PGI 2011. And Schilder's principle and objectives of cleaning and shaping given by Schilder, that's very important, asked NAMES 2014. And also the basic part, we have questions on color coding of files, right? White, yellow, red, blue, green, orange, right? So there is nothing like orange for that matter, right? We have this basic 6 size will be pink, 8 size will be gray, 10 size will be purple, and from 15 you will be having this repetition of colors: white, yellow, red, blue, green, black, right? So even while I was practicing multiple choice question, I used to go wrong in this color coding as well, right? So we take this for granted, but we need to be more strong and specific, especially while answering easy questions, right? That's very important. And now, so that's pertaining to biomechanics, irrigants, cleaning and shaping technology, etc. Now we'll see disinfection and obturation. So in this topic we have questions on vertical compaction. So just focus on various compaction methods, right? Various types of obturation materials, in specific vertical compaction, right? And also ideal properties of root canal filling material. That's a basic part where you start with, right? And also, what is the indication for silver cone obturation? We have that question in NEET 2013. We also have a question on a post and core, the amount of apical seal that has to be maintained while preparing a post and core. And asked in Comet 2014, we have one question on tuck back. What is tuck back and what does it mean? Asked in Comet 2014. And also we have a question on sealer extrusion asked in PGI 2013. And also a question on a needle of which gaze is used for irrigation. 25 27 gauge, right? A question on that in PGI 2011, and also a question on EDTAC asked in PGI 2014. So all newer irrigants, you need to focus on newer irrigants given in your latest edition of Grossman as well as in Cohen, right? Also a question on AH26 toxicity, right? Formaldehyde release asked in Comet 2016, right? So these are some of the topics in disinfection and obturation, right? And coming to bleaching, so bleaching, you have this vital, non-vital bleaching, at-home bleaching, and in-office bleaching, right? So you need to understand the classification and various chemicals used and the mechanism and what exactly is being done in each procedure, right? So in non-vital bleaching, vital bleaching, and also the complications of bleaching. Even we have questions on that particular topic as well. And now to be more specific, we have questions on walking bleach asked in Comet 2013, role of GIC in bleaching and endodontically treated teeth or endodontically treated discolored teeth. So what is the role of GIC in sealing the pulp chamber? We have one question on that as well, and also a question on tetracycline staining, and till what age does this occur, and also what should be the concentration of the drug in order to cause this kind of staining, and how do you correct that clinically, by what techniques, right? And also we have questions on agents used in home bleaching technique asked in AP 2014, right? Also we have questions on microabrasion technique asked in Comet 2015, right? So these are some of the topics in specific from bleaching. And in endodontic surgery we have the following topics. We have topics, I mean, we even made one video on endodontic microsurgery. You can watch that in YouTube. So we have mentioned various differences between conventional surgery and the latest endodontic microsurgery using dental operating microscope, and you can expect lot many questions, different variety of questions from that topic, as well as that's the latest, as that's the norm that's being followed right now, right? So in endodontic surgery we have questions on Luke Bay Oxenbean flap. So you can watch a video, I mean, how the flap design is being made in that particular video as well, right? And also I have question on period of immobilization for reimplanted mature teeth. So this splinting duration varies for various procedures. We'll discuss all that in separate videos, right? We have that question as well in APPG 2015, right? So these are from endodontic surgery. And in traumatology we have questions on the following topics: avulsion management. So avulsion, so the medium for avulsion, how do you manage it? What should be the extraoral dry time? What is the best possible media to carry these avulsed teeth, right? So these topics are very important. Asked in AIMS 2013, AAPG 2014, AAPG and AIMS 2014. So we have several questions from the avulsion topic, right? So focus on that. And also a question on reaction of tooth to trauma asked in Karnataka 2013, root fracture repair asked in Comet 2014, pulpotomy asked in AAPG 2014, Jones associated with calcium hydroxide placement given well in Grossman, you can refer that, asked in AAPG 2014, and common tooth injury. So what is the most common tooth injury which we see? Enamel fractures, right? Asked in PGI 2016. Pulp capping, we have a question on direct pulp capping asked in APPG 2015, and also a question on endogain. Endogain is enamel matrix proteins which are derived from the pig teeth, teeth of pig, right? So even that's approved by FDA as well. And we have question on direct pulp capping, as I said, replacement resorption asked in Kerala 2016, and also a question on reimplantation asked in AIMS 2015, right? So these are some of the topics in traumatology. And various miscellaneous topics, we have questions on triple antibiotic paste asked in PGI 2014, MTA setting time asked in AP 2013. So it's longer, right? 2.5 to 3 hours, right? It is accelerated in hydrophilic atmosphere. And post and core characteristics, what should be the nature of post, serrated, parallel, or is it of a different configuration? So that kind of orientation, understanding the characteristics of post retention as well as post width is also very important, given well in endodontic Grossman, right? So you can refer Grossman in the prosthodontic considerations chapter, where it's given in detail there. And also you have questions on pulse oximetry, clinical diagnostic methods, heat test, cold test, EPT, all they are basic and important as well, right? So EPT you need to concentrate on false positives and false negatives. We have questions on pulse oximetry, test cavity, working length determination in case of young permanent tooth where we have wide open apex, where we use paper points. That's the best way to determine working length in case of young permanent tooth. And also questions on apex locators, various generations, second generation, fourth generation. We have these questions from APG as well as in AIMS previous papers as well. Single visit endodontic indications. What is a hot tooth? Asked in PGI 2012, which is difficult to anesthetize, of course, right? And also we have questions on antibiotics in regenerative endodontics, differences between periapical and periodontal lesions clinically. What is active GP? GP with GIC, active GP. Fiber post and metallic post, asked in AIPG 2015. Different procedural errors like jipping, ledging, transportation, asked in Kerala 2016. Dental operating microscopes, asked in Comet 2016, and we have a question on loops, asked in PGI 2016, and various questions on revascularization of pulp, various false positive and false negative responses in EPT, and also we have several case-based questions in Comet or even in AIMS. They'll give you a radiograph or a clinical picture, give you the description, and based on that they can ask you questions either on deep abrasions, young permanent tooth, phoenix abscess, discoloration based on condition of pulp. So you can have different case-based questions, radiograph-based questions, clinical picture-based questions in endodontics as well. Also there were some miscellaneous topics covered like pulp polyp, mouse hole effect, asked in PGI 2016, champagne bubble technique, asked in PGI 2015, and also of course on pro taper, the diameter of the instrument when it's cut by 1 mm, various questions likewise asked in PGI 2015, right? So these are some of the important topics in endodontics, right? So refer Grossman as well as Cohen, keep them as standard textbook references, practice as many multiple choice questions as possible. Start with synopsis, do multiple choice questions pertaining to that synopsis, refer explanatory answers, and then refer standard textbook references, have a customized note, start writing a customized notes, and then start the cycle all over again, right? So try to follow the same cycle for all the topics, then I'm sure you'll master any topic in any subject for that matter, right? Hope it's clear.